My name's Amanda Napel. Thank you for coming to the Lunch and Learn that the hospital is putting on and asked me to complete. So when I was asked by Bree to put this on, she didn't really give me like a topic except mental health, right? So mental health is very, very broad. So I thought about it for a while. Like, do I do one on depression? Do I do one on anxiety? Do I do one on suicide, right? All of these topics we could talk about for an hour or more. So I talked to a couple people, and the biggest thing they wanted me to talk to people about was just letting people know it's okay to get help, right? It's okay if you don't have depression or if you don't have anxiety, but you can still go to therapy. You can still go talk to somebody. You can still maybe a medication would be appropriate for you. So that's kind of where we came up with the title of Destigmatizing Mental Health. So I'm going to leave you with a definition to think about throughout this presentation. So the definition of stigma, which we hear a lot with mental health, is a mark of disgrace associated with a particular circumstance, quality, or person. So if you think about why people don't seek help for mental health, and then you think about that definition of stigma, it's very pointed, right? Okay, so a little bit about me, just to ease us up a little bit. I grew up in central Iowa with my parents, and I have an older brother. I always enjoyed pretty much anything sports, and still do. School Vikings. I met my husband Travis in high school. We've been married almost 10 years. I moved to Sibley in 2014. He moved here in 2013. So we've been here about, over 10 years now. We have two sons, 8 and 5, and they keep us very busy, and it's helpful that I like sports with them. In Sibley, I'm involved in our Rotary Club. I'm soon to be president of that. Our SO Athletic Booster Club. We have an Osceola County Leadership Group that I'm a part of. Helpful with the Ochim Catfish Club, a member of the Sibley Chamber, the First Presbyterian Church, and just kind of support all of our local things happening. For education, I went to Iowa, got my bachelor's in psychology, and then I went on to St. Cloud State University for my master's in marriage and family therapy. While I was attending school there, I was able to live here and still go to school there, so I did my internship at Southwestern Mental Health Center in Worthington. And then once I graduated with my master's, they hired me on to stay, and I was there until 2019. But in 2018, I took a part-time position with a company called Interconnections EAP, and they're based out of Rock Valley. We'll kind of talk about EAP a little bit later as a tool to use in the therapy world, but I was there for a couple of years as their clinical case manager. In 2019, I transitioned to Iowa finally. I tried for many years and went to Creative Living Center. There I was in Rock Rapids, I was in Sheldon, and I was in George Little Rock schools. So very busy, a lot of driving. And then of course we all know what happened in 2020. So the mental health world really changed. We went full telehealth for the first time ever. And as you can imagine, I could not go into schools, so I couldn't see those clients, and a lot of people dropped off. So my husband and I sat there and talked about it, and I didn't want to drive anymore, so decided to take that time to open my own practice. So in August of 2020, I opened Interconnections Therapy here in Sibley. So my office is located within our public health office behind the hospital there, or as a lot of you probably know it, the old clinic, from what I hear. Okay, so you see a lot of letters behind our names all the time. My letters mean I'm a licensed marriage and family therapist. I'm licensed in Iowa and Minnesota. The Minnesota licensure allows me to see clients that live in Minnesota, so if they're in Minneapolis, I can see them via telehealth and still be staying within the lines of my licensure. The Certified Employee Assistance Professional is one that I got while I was working for the EAP company. It just kind of helps me know that I have to factor in the workplace as well as the individual when I'm seeing those clients. And the SAP is a Department of Transportation qualified substance abuse professional. Not something we'll really touch on today much of, but if I use that here, it's usually that a CDL driver failed a drug test, and so they have to go through the SAP process with me to get back into the truck. So if you have questions about that, we can talk about that after. Here are some other letters you might see behind a therapist or a counselor's name. These are not all inclusive, there are more that you can find out there. So there's licensed mental health counselors, there's licensed independent social workers, there's licensed masters of social workers. If there's a little T in front of them, that means they're temporary licensed, so that means they've graduated with their master's, but they're still under supervision. It takes 2 years, is kind of the minimum to get to full licensure for our degrees. Therapy, I've had questions before about what's the difference between a therapist and a counselor. Not really any. And I would say in this area, if you find anybody with these kinds of credentials, you're going to get about the same type of treatment. Of therapy is going to look very similar. And they can, depending on what they specialize in, you can deal with them. The bottom two here, so the doctorate of psychology, or you're a clinical psychologist, they will typically do testing. So that's maybe testing for ADHD, testing for bipolar disorder, schizophrenia, those kinds of things. They cannot prescribe medication, whereas an MD or a doctorate of psychiatry does prescribe medication. So there's the difference there. And then there's even more in that world, right? We have Tasha here, who's a nurse practitioner who can also do medication, but is on the psych side. So it gets a little confusing. So make sure you ask questions about that stuff if you're confused about it. Okay, we're gonna kind of go over just some myths that we hear with mental health. These are not all of the myths we could find. There's actually a whole site on this SAMHSA website that goes over myths of mental health, but these were the 5 that I felt were the most important to kind of address today. Mental health issues cannot affect me, so as an individual, no, they're not going to touch me, right? That's kind of a myth we see a lot. People who struggle with their mental health maybe cannot hold a job. Big myth. People who seek therapy have serious mental health conditions. We'll tackle that one. Seeking help makes you weak, especially men. We don't have very many men here, but we're gonna address that as well. And then that I cannot do anything for a person with mental health. So meaning you as the lay person. What do I know about it? How can I help them? They just need to go talk to somebody that knows about it. Also a myth. Okay, so the big one. Mental health issues cannot affect me. So actually 1 in 5 adults experience a mental health condition in a given year. So if we look around the room, not that we're pointing around, there's 40 of us in here? That's a lot of people that are struggling with a mental health condition, let alone maybe not something diagnosable. Maybe they just had a recent loss or something like that they could want help with. 1 in 6 young people have experienced a depressive episode. Their definition of young people, I think, is pretty young, probably 5 and up. So if you think about 5-year-olds and 6-year-olds having depression, it's a real thing. And then 1 in 20 Americans have lived with a serious mental illness, and they consider serious mental illness schizophrenia, bipolar disorder, major depression, something that you're typically on medication for a long time, if not forever. In 2021, they found that suicide was the 2nd leading cause of death for people ages 10 to 34. Age 10 is what stuck out to me when I read this statistic. And unfortunately, we are seeing more and more of that 9, 10, 11, 12-year-olds that are attempting, that are, completing suicide. So it's very scary. The other stat that really stuck out to me was that suicide claimed the lives of over 48,000 people, which was nearly twice the amount of homicides. So in 2021, there was almost double the amount of suicides than there were homicides. So what do we see on the news? Homicides, right? Maybe there was a stabbing, maybe there was a shooting. Every time you see that, 2 people have completed suicide. So it's everywhere, unfortunately, but we want you to know there is help, okay? Okay, people who struggle with their mental health cannot hold a job. I think the stigma there is that, mental health makes them not ambitious, they're not motivated, they're not intelligent, maybe some people feel. They're maybe just not able, cannot handle stress, they're too sick, or even potentially dangerous. We're not going to dive into that, but you know what I mean when I say people think that people with mental health are potentially dangerous. When really, they're just as productive as other employees, and they polled some employers who were actually aware of their employees' mental health, and all of them, said those employees are just as productive, they have good attendance, they have good motivation, and they've actually been here a long time. So I think if employers can get on board with it, employees struggling in those areas can really feel valued there. And looking at my client list, I would say the majority of my clients have a full-time job, full-time students, maybe they're full-time students and full-time jobs, or stay-at-home parents doing school, like very, very high-functioning people in our society. I think this is the one that really sticks with me, that you have to have something really serious going on to go to therapy, or you have to have one of those serious mental illnesses like schizophrenia or bipolar disorder to go. That's hopefully not true at all. I hope that the majority of my clients don't have anything like that diagnosable, and they just come to seek help and to talk to somebody. So not everyone who benefits from coming to psychotherapy, counseling, whatever you want to call it, is diagnosed with a mental illness. We can help with life stressors, resolving conflicts, whether that's within your family or your workplace or things like that, coping with major life changes, anything you can think of. Okay, seeking help makes you weak, especially men. The statistics on this were just kind of scary. You'll see that in the next slide as well. But so in 2021, the male suicide rate was 4 times higher than females. Okay, yet more females sought help. So we have men struggling at 4 times the rate, and more females actually receiving services for that. So we're missing that gap there. I think the majority of you can think about how men grew up, right? Men don't cry, rub some dirt on it. If you seek help, you're weak, right? I think we're hearing a lot with male suicides that they feel they're more of a burden if they continue to be alive, and so they take that route, whereas I think all of us would say that's not true, and we want you to reach out to somebody or ask for help. So suicide rates for males were actually, when they looked at all the age groups, they were highest among those aged 75 and older. Which it took me aback, honestly. I don't feel like we hear that much about that here. But then I think back to, like, what was it, 2021-ish time, there was kind of a farm crisis around here, and the EAP company that I worked for, Connections EAP, was actually working on creating an EAP just for farmers because they were getting a lot of calls about, I'm worried about this guy, like he's really struggling, this is his livelihood. So I do think it is probably in our area as well, and something we need to take into consideration. Seeking help should be seen as a sign of strength, right? It takes a lot of strength, even just to make the phone call, or send an email on the contact on my website or somebody's website to reach out for help. So make sure if there's anybody in your world that you let them know that it's okay and it's a sign of strength, and it should be associated with wanting to better themselves and feel better, not to be weak. Okay, so what can you as the layperson do, right? Maybe I can't do anything, you feel that way. But only 10% of adults received counseling or therapy from a professional. Okay, so what are those other 90% of people doing if they are struggling? They're calling their friends and their family, right? So you can make a huge impact on somebody that's dealing with this. You can let them know you are available at your own capacity. Make sure you have some boundaries there. You can help them access services. You've got a great handout today that lays out our local services. It lays out some Iowa services, some national services. We have our wonderful hospital social worker that I'm sure has a list of services that she could help you with. You can always contact me. Or just now that you know a little bit more about it, you can help them even research it, right? How do I research a licensed marriage and family therapist in Ames, Iowa? If that's where your family member is. It's very easy, but you can help. Make sure you're treating them with respect still, even if you don't understand what they're going through. It's no different than if you have never experienced cancer before, but your friend has cancer. You're still there for them, you're still supporting them, you're still treating them like a human. It can be the same with somebody maybe struggling with depression or anxiety or something like that. We want to make sure we're not defining them by their diagnosis or calling them words like crazy or those kinds of things. They call it person-first language. So we're not saying that person has depression. We're saying that person is struggling with symptoms of depression, or they're experiencing mental distress, or those kinds of things. We're really taking the person out of the diagnosis. Okay. So we're going to kind of switch gears into just understanding what kind of therapy looks like, since that is what I do every day. So outpatient mental health therapy, there are no doctor referrals needed, so maybe a little different than what you would experience with like physical therapy, or if you needed an MRI or those kinds of things. Sometimes you have to have those referrals. There's no referrals needed. You can call by yourself and make an appointment. The majority of health insurances do cover mental health therapy costs, or at least cover the sessions. I have never had one that has limited the amount of sessions. I think about like chiropractic care, they maybe get so many visits a year. I've never had one limit mental health visits in a year. You would really just want to check that your provider is going to be in your network, and you're going to want to know about your deductible and those kinds of things, right? If you have a higher deductible plan, you're probably going to be paying into your deductible for the sessions, just like you would if you went to the doctor under that plan. There are exciting news, I guess we could say. In January of this year, Medicare has now accepted my licensure, so licensed marriage and family therapists and licensed mental health counselors. Before, you had to have either a doctorate degree or be a clinical social worker to see anybody with Medicare for mental health services. So it's very exciting. I think they're struggling a little bit to try to keep up with all of us that are entering their system, but it is huge for our community and for these rural communities that have not had very much access to Medicare people being able to be seen by therapists. Okay. There's always the private pay option, so every therapist is going to have their own rate for that. You're just going to have to discuss it. There's some clients that don't want to touch their health insurance for it and would rather just pay each time. And there's some therapists that only accept private pay clients. You just have to kind of assess that when you reach out to them. In certain aspects, or typically with our community mental health services, which would be Season Center, or if you go up into Minnesota, Southwestern Mental Health Center, they can do sliding fee scales and look at if it's not affordable for you, how can we make it affordable for you? It's a little bit harder for our private practices to do stuff like that, but we can maybe do payment plans or those kinds of things to help with the cost of it. At the end of the day, we're all in this field because we like to help people, so it's pretty hard to turn people away if they're like, oh, I can't afford that. We figure something out. EAPs, there's those word again, and we'll get to that on the next slide. But then telehealth, like we said, with COVID, we've had a lot more access with telehealth services. It's been pretty nice for me, mainly with the clients that move. Whether I start with them in high school and then I can see them when they're at college or when they move to their new home with their new husband, things like that. But then you also have things like BetterHelp, which is a nationwide telehealth, and they have services at any time of the day from what it sounds like. So, but it's more expensive and they don't accept health insurance. So you just have to weigh those pros and cons. Okay, so the EAP, I kind of touched on this. So the Employee Assistance Programs, this is typically a benefit you would have through your employer. They offer 3 to 6 sessions, typically just kind of depends on the EAP company, and it is free to the employee. So we as the therapists are not allowed to charge you extra than what that EAP is paying us to see you for. A local example, again, is that Connections EAP. The hospital has Connections EAP here, CFE, Hope Haven. So those are just some of the employers here. So all of those employees at those places and their spouses and dependents have access to 3 sessions for any issue. That could be that they lost somebody, that could be that they're having anxiety, that could be that they're struggling in their marriage. So they call Connections and they set them up with a counselor and they get those free sessions. I would recommend, if you are going to do that you just verify that that provider can see your health insurance after you're done with the EAP. Typically they go more than 3 sessions. So just make sure you're checking that out. The CFE Shareholders is the program I was discussing earlier when we were noticing kind of the farm crisis. So if you or anybody that you know is a shareholder at CFE, you actually have access to 3 free sessions through Connections EAP. And CFE was just very worried about the people that they were dealing with and the farmers that they were hearing about. And they wanted to have disability. I would say last time I talked to Connections, they didn't say it was being used very much, and most likely because of why we're here today, the stigma, right? So if any of you can leave this room and you know maybe somebody that would fit the bill and they're a CFE shareholder, tell them they have access to some free sessions, okay? And they also support the Osceola County Emergency Services, so our police officers, our ambulance, EMTs, those kinds of people have access to that as well. Okay, so hopefully you're laughing at this, and this is not what you think a first session of therapy looks like. I do think that some people assume this is what they're going to get. There obviously are offices that have couches and things like that, but this is not it. So what to expect? With me, as an individual provider, I do not have a front staff. So we are doing everything with me in my office. If you went to a season center or some other place, they would have a front staff that would work with you on this kind of paperwork. So you're giving the basic information, right? Your name, your date of birth, your address. We're looking at your insurance. We're figuring out a payment plan. You're signing your HIPAA consent that your privacy is protected under HIPAA, and you're signing releases of information if you want that provider to be able to communicate with your doctor, or if you're signing for your kid, right, if they're struggling in school. So I could communicate with the school if you signed a release of information for that. And then we go over kind of the informed consent. And for me, that looks like a lot. It's 3 pages of stuff, just a lot of wording. But for people that have never been to therapy before, they don't know what to expect. So I want them to kind of know what this is going to look like, right? Some people don't even, how long am I even going to be in this room? So I explain, appointments are usually 50 minutes, 55, sometimes tend to be an hour, but never over an hour. If we're worried about safety, then we're trying to get you in once a week, if not. But otherwise, for me, schedule-wise, it tends to be every 2, every 3 weeks, just with how many clients that I have right now. We talk about if you have to cancel, make sure you do that 24 hours in advance. So I can call somebody and say, hey, there's an opening, come take it. We talk about their payments, their insurance, all that stuff. I explain my office hours. I give them emergency phone numbers to utilize, as I don't have an emergency phone line. We talk about confidentiality, right? So the biggest thing of therapy is that you get to come into this little office that I have, and you get to leave stuff in there, and I can't do anything with it unless you authorize me to do that, right? I can't leave the office and go talk to my husband at home or my friends or anything like that about what we just talked about, because that would be against the law. The only things that we have to talk about is being a mandated reporter. So if a child is being abused, we have to report that to the state. If a vulnerable adult is being abused, we have to report that to the state. If we are very concerned about their own mental state, if they're suicidal, and I always say that that's to the point that I don't trust them walking out of my office that day, then we look at a safety plan for that, right? Whether it's me walking them to the emergency room over here, or it's having somebody taking them to a Vera Behavioral in Sioux Falls. So just those kinds of routes. The other thing would be we have a duty to warn, they call it. So that's if somebody comes in with a plan of homicide. Luckily, I've never had that, but if it did happen, that person in your office is not in the best state of mind, so we have to keep them safe, as well as warn the person that is potentially in danger, and just making sure that they're okay as well. Since we're in a small community, Sibley is, I know it's a metropolis, but it's very small. I have to talk about if I see them out in public, if they see me on social media, those kinds of things, and how we address that. I am not their friends on social media, not their Facebook friends, right? Or calling them on or they're not calling me on my cell phone. Or if I'm grocery shopping and they're there, I'm not coming up to them, talking to them about our sessions or how they're feeling, or, hey, see you next week in my office. Nothing like that, because that would be against their privacy, right? And I think the majority of them that come know that they're going to see me. You saw my list of involvement. I'm very involved in the community, and so you're going to see me out and about. And I think some people really like that, and some people maybe don't. But I talk about that I don't discriminate against them for any reason, so whether that's maybe religion or race or things like that, they can come seek help. And I asked that I'm not subpoenaed for court, but we don't need to dive into that. Okay, so one question for you. What do you think is the most important factor that leads to successful treatment and therapy? Admit you need help.
Consistency.
Consistency.
Trust.
Trust. Okay. Anybody else?
Honesty.
Honesty. Good one. Okay. Very close. The therapeutic relationship or the alliance, right? So basically, the relationship between the therapist and the client. And it's actually the patient's or the client's perception of the quality of the relationship that has been shown to be the strongest predictor of treatment success. So if my client feels like we are really in tune with each other, they're more likely to see it as that treatment is successful versus if I'm maybe like, ooh, I don't know if this is a good fit. The really cool thing about this is that this has been studied so many times, and it has been studied across individual sessions, couple sessions, family therapy sessions, which you can imagine is a lot harder to build trust with 2 people, 3 people, 4 people, and to have them all feel like they have a positive relationship with you. It's been studied in inpatient settings and outpatient settings, with children, with adults, and then across a variety of symptomatic problems, right? Whether that's maybe depression, anxiety, anything down that list. The biggest predictor of success in therapy is that relationship with your therapist. So keep that in mind when you are reaching out to a therapist and maybe you don't feel super in tune with them, and then you say, or maybe you've heard people say, I tried therapy once, it didn't work. How many times did you go? 1. I didn't like them. Okay, well, let's try this again. Let's go somewhere, talk to somebody else. Maybe you would like them, maybe you feel like comfortable with them. If you are in therapy at all and you feel like you're struggling with your relationship with them, whether that's been a couple of years and things are changing, have a conversation with them about it if you can. We don't get a lot of feedback, I would say, so it's helpful for us to know if you want us to be doing something differently or if you feel like things are different, and we can talk it through, right? That's our job. Okay. So trust. Okay, so when should you call a therapist? So all of these are directly from the NAMI website, which is the National Alliance of Mental Health. This is not a foolproof list. And again, like I said, you don't have to have any of these symptoms. You could just want to talk to somebody, and you should call a therapist, okay? So you could be having excessive worrying or fear. You could be feeling the kind of really, really low, down, blue symptoms. I've noticed a lot since COVID, we have some like brain fogginess people are talking about. So we're kind of deciphering, is that from COVID, or is that you're maxed out on stress and you have a lot going on in your life and it's hard for you to put all of that together. Troubles concentrating. If you're noticing really extreme mood changes, a lot of people that are feeling euphoria, as it says, are not very likely to seek therapy because they're feeling really good. They're maybe on top of the world, but that can be a sign of mania and things like that. You could have prolonged or strong feelings of irritability, anger, quick to anger. You might be noticing you're starting to avoid seeing friends or doing social activities. You want to stay at home. You want to be by yourself. You have difficulties understanding or relating to other people. You could have changes in your sleeping habits, feeling tired and low energy, changes in eating habits, changes in your sex drive, difficulty perceiving reality. So that would be maybe you're seeing things that aren't really there, you're hearing things that aren't really there, you're maybe having delusional beliefs that somebody's out to get you, or they're listening to me from the TV, those kinds of things, right? If it gets to a certain extent, then we're concerned about it. You might have that inability to perceive changes in your own feelings, so kind of a lack of insight in yourself. And if you feel like you're maybe starting to overuse on substances like alcohol or drugs, we can touch that to a degree if we feel like it's a major problem, right? Whether we want to diagnose you with alcoholism or a drug use problem, we would refer you to somebody in that specialty as well, but it does help to have both providers on board. Physical ailments without causes, right? If you've been to the doctor a lot of times because you're having headaches or stomach aches, a lot of aches and pains, but they're not really finding any reasons, this can be a mental health thing going on. I've had a couple clients that have a lot of back issues and have very much determined it is when they're maxed out on stress and anxiety, and not that they actually have back issues. Obviously thinking about suicide, and if you're finding yourself not able to carry out daily activities, stress, things like that. And then anything with your weight or your appearance or viewing your body in a negative way, anything like that we can talk about. Okay, so perfect. Typical day with me, I feel like I get this question a lot, so I'm just going to touch on it, and then I'm going to leave you with a little bit, and then we'll do questions. So the top three are just probably the most common therapies that I use. With being a licensed marriage and family therapist, I do see quite a few couples, so I do a lot of couples work. EMDR is a whole other thing, and we could probably do 4 lunch and learns on that. But it was started for trauma therapy with soldiers and has since moved to being utilized with other disorders, but it's proven very, very high success rates, which is cool. I see clients of all walks of life, right? So they have depression, they have anxiety, they have PTSD, they've been abused, they have eating disorders, they just lost their spouse or their child. They're just stressed. They're business owners, or they're high up in their jobs and they're feeling overwhelmed, right? They have family conflict. They do have suicidal thoughts. They self-harm. They cut. And everyday life, right? All those stressors. I used to see clients like at age 4, and I've kind of gotten out of that. I do have clients right now that are 6 to age 88, so kind of a variety of range, but we're in rural Iowa, right? I get to see everything, which I honestly really love. So my days are 8 to 9 clients a day on the hour, and seeing kind of all these variety, which is good for me. Okay. So I felt like this was kind of a speech like promoting myself and that you should come see me. So I actually asked a couple of my clients for their help of just what would you want this group to take away from today, right? Like as the client yourself, what do you want them to know? Because I can say I'm great all day long, but I don't want it to be about me. I want it to be about somebody going out and seeking help with anybody that can help them. Okay, so here's one. For years, I lived with a perception that asking for help is a sign of being weak. Calling for help was one of the hardest phone calls that I have ever made, but it ended up being one of the best. Having someone to vent to or lean on who can give guidance without judgment or that very personal attachment has been very beneficial to me. Can you guess the gender? Okay. Amanda introduced me to EMDR therapy to help me with childhood trauma. It has really worked to help reduce the effects of the trauma so I can feel better about myself. It is so nice having a place I can come to and talk about anything and everything without feeling judged. The thought that therapy makes you a weak person is totally off. That macho attitude isn't necessary. I can come here and this is the safest place I feel I have to talk about anything that is on my mind. I would highly recommend it for everybody. Again, can you guess the gender of that one? This next one's kind of my novel list, so. I have many titles that require me to be a leader, decision maker, one who sets the example, and a pillar of strength. And because I am a man, it's all supposed to be done without complaining and without showing weakness. After years of shouldering this burden, combined with trauma from my childhood, the cracks in the veneer began to show. I did my best to rub some dirt on it and move on, but I was just treading water. It wasn't until I was urged by a good friend to consider therapy. My response was what most men of a certain age would give, a gut laugh. I reminded this person that while I could be insufferable at times, I am not crazy. It took months of gentle prodding before I finally realized that, as a business owner, I always seek out every opportunity to improve my business. Why wouldn't I do that for myself? Therapy helps me be the best father, husband, business owner, friend, and man that I can be. It not only helps me relieve the burdens of all my different titles, but also helps me see things from a different, unbiased perspective. Therapy has genuinely improved every aspect of my life. The only regret I have is that I was too much of a man's man to do it sooner. All right, so these are just your mental health resources. You have all of these on your handout. Questions?
Back a few, there was the letters CFE. What did they stand for?
Cooperative Farmers Elevator. So that's our local elevator here. Mm-hmm.
And one thing I wondered if you wanted to touch on as a, perhaps another reason to seek therapy is kind of combines with what we do here. People who have a sudden change in their health, especially maybe an unexpected change at a younger age. I know I have a son who was diagnosed with a fatal heart condition at the age of 38, and as a man, it took us a long time to convince him that he maybe needed to talk to somebody about that.
Yes, yes. For the live feed there, it was another reason to seek therapy is if, they were maybe diagnosed with a life-changing physical thing or just something like that at the hospital. And she noted her son had taken a lot of time to get to that point, but is now seeking help. Yes, definitely, right? Any major life change of any capacity can be. Yeah, and it's hard to talk to those people when, it's a different goal-setting type of thing, right? Like, we're not getting to think about life, we're thinking about life in a different way. But they still, I would say the majority of them would say things like, I don't want to talk to my family about this because they're already stressed about it themselves, or they're worrying about me. I don't want to put my worry on them. So for them to come to a place like in my office or another therapist's office, to just kind of let that go and leave it in that room and walk out, that is really what is the best for them.
Amanda, sometimes in the hospital we see some patients that have some symptoms of a mental health illness that may manifest itself in a physical symptom. Is that fairly common?
Yes, so Wendy from the hospital pointed out they see clients with mental health, but as well as like physical health symptoms that they feel like might be coming from the mental health side of things. And yes, I would say it's probably even more common than we even realize, or I even realize. I think the more clients you have that come in and say things like that, you start to be like, maybe this is a real thing going on here. I would say the biggest thing that I notice is probably headaches and stomach aches. And a lot of that can be tested, right? They're going in for a lot of medical testing and they're never getting answers. So to approach that with them is tough, of like, hey, it might be your mind doing this a little bit, or maybe it's maybe your anxious thoughts are creating some of this stuff. It's kind of touchy, I would say, to deal with, but it is happening and we have to deal with that, yeah. Do you feel like it's destigmatized a little bit for you, at least? Okay, good. All right, Bree's gonna sign us off here.
Thank you guys all for coming. Don't miss our next Lunch and Learn, and I hope you learned a lot today. I know I did.